I just love that you kind of like encapsulates how trauma affects us in every part of it.
Yeah.
How do we identify it within ourselves though? If you, like you mentioned that it's either the event or the experience, right?
Sure.
And sometimes the experience gets a little murky. Like, am I, like somebody might ask, like, what happened to you that you think that you are suffering from trauma or dealing with PTSD? But is there something that we can kind of like utilize as a benchmark within ourselves to really be able to take care of ourselves by recognizing it?
Sure, that's a great question. I also want to note that it's important that we understand there are negative events that can happen that don't have to be classified as trauma. And we can have trauma that will not necessarily lead to a clinically diagnosable trauma-related disorder.
Yeah.
Right? Like you mentioned PTSD. People can live through trauma and not necessarily develop PTSD.
Right.
And it doesn't mean that whatever symptoms and signs that they may be displaying or presenting are less important, right? Because they don't necessarily have that diagnosable disorder, right? So it's important to note that, because you're asking the question, especially as the topic of mental health grows and people become more familiar with the language and comfortable using it. Sometimes it gets misused.
Yeah.
It just kind of goes with the territory. So when you're asking the question of how do we identify it in ourselves, if you can remember a time before the trauma happened, and you can remember how you were and who you were before that, and you're noticing changes in the way you behave or interact with people after a traumatic event, that's a good sign that maybe the trauma has impacted you in some kind of way, and it's deeper than, whenever it just happened in that moment, but is actually living with you. For a lot of people, though, who may have experienced a trauma at a young age, they may not have the luxury of remembering themselves prior to the event. And so I would say, thinking about if you find yourself like hyper aware or hyper vigilant or sort of assessing areas and assuming threat most of the time, that's probably a trauma response. Because what happens after trauma, and I'm sure we'll get more into it later, but what happens after trauma is that typically in an event, when it happens, you feel powerless and you feel helpless, right? Because again, the definition of it is that whatever is going on is overcoming or overwhelming your ability to process and ability to cope and manage and your capacity to navigate the situation. And so when you find yourself in those situations, or you find yourself having survived a situation like that, afterwards you tend to be easily triggered, because anything can be a reminder or reminiscent of the time when you were left powerless in a situation. So you tend to judge everything through the lens of like trying to hurt you or being a threat to you, right? And so if you find yourself like hyper vigilant all the time, you might want to think about, or if you're aware of a trauma that you've lived through, you might want to go back and trace some of those hyper vigilant ways of showing up in the world back to that and see if they're connected. Likely they are.
We talked about when you have the language to describe what you feel and what you're going through, it helps you kind of face the monster. Can you talk a little bit more about that?
Yes. So people who live through traumatic events often will develop a disorder called alexithymia, which is essentially where they lose the ability to identify and name their emotions. Like they don't have the words. So what will happen is, one of the things I look for is that if I ask them how they felt, they will often respond with like what they would do, because they don't have the language to say. So like, for instance, I would say like, what would you do? How would you feel right now if a bear just crashed through the door? And if you said, I would run. But how would you feel? They don't know. They don't have access to the language to say, I would be afraid. Right? So that's a key sort of sign for me. If I'm able to ask a feeling question or an emotion question and a person isn't able to answer, and they answer with an action, then it's like, okay, you may have lost that language. And we know that language is very, very powerful. It's limiting, but it's powerful. Particularly if you have a story within you that you need to externalize and get out so that it's not a part of who you are, but something that you survived and lived through, a thing that happened to you, right? If you don't have the language to do that process of externalizing, then you, in some cases, are disempowered, right? And so doing things like introducing the language of emotions, doing things like moving in rhythms instead, doing things like what color would you choose that would match up with how you felt in that moment? Right? Like, so giving them other ways to communicate the feeling that may not have to be language, right? Spoken word language, I should say, because there's language in movement. There's language in all kinds of other ways. And so noticing up front, because again, if a person has lived through trauma and they felt powerless, the last thing you want to do is put them in a room where they don't have the language to explain that and keep asking them to do it. And then they feel inadequate and powerless in that moment too. And you're just, continues. So if you notice that they don't have the capacity to do that, be creative, invite other ways, dance it out, draw it out. I mean, I'm serious. This is real, right? This is very real. We've all seen movement that has brought us to tears because we can see the power and the emotion in the story, right? And so that is available to people. Drumming is a very huge new intervention that's coming around. It's not new. Obviously, we know ancient drumming. Years Africa, but in terms of its use clinically. It's new, and that's an emerging way that people are working through trauma, creating rhythms and getting that somatic piece and that energy to move and do that. So there's ways to access those emotions and then beginning to develop language around it such that when they are ready and the time is right, they will have access to the words to say, I was afraid, I was, whatever, I felt powerless, I felt hopeless, I felt helpless, I felt violated, whatever the things that they may be able to say. There's so many other ways to express that don't have to be limited by the language that a person may or may not have.